introducing some of the speakers. And I want to really thank the project team, which is the Peel Newcomer Strategy Group team, like Cassandra Bangay, who's our research consultant, and Teresa Xaria, who's our service integration specialist assisting today, and the Center for Community-Based Research, who has played a really integral role in this project and in looking at some of the in-depth insights that we can bring forward to really broaden our view for this project. So I'll move to the next slide and just give a sense of the agenda for the day. So we're going to have an interactive discussion after a little bit more background and really think about connecting some of our current and emerging issues in Peel Region with some of the possibilities with a regional structure. We're going to look back at our current sector structure based on an IRCC funded agency survey that was done in June. And then we're going to dive into some of the research that's been done through a literature review around what elements are we actually looking at with the model, and then what are some next steps, and really getting your feedback on the session today. So I'm going to pass it on to Shalini Dakunha. She's the Executive Director at the Peel Halton Workforce Development Group, who's going to introduce our advisory committee, and they've been really helpful in guiding this project to date. Hi, Shalini.
Everyone, I think based on what Jessica just said, we truly acknowledge the contribution of each and every member of the advisory committee. I know some of us are here today, some of us are not, but we were really privileged to have an advisory committee that represented diverse organizations in terms of size, in terms, some of them are just informal, but also the perspective and experience that came with each individual who sat there was absolutely amazing. We've been meeting bi-monthly, and the guidance and the input from the advisory committee has been instrumental to where we are right now. I know Jessica just mentioned about we've broadened the group right now. We also have frontline staff today and newcomers because that lived experience, I think we recognize what a manager in an organization experiences is quite different from what you see on the frontline staff. They actually come to terms with a lot of the issues and likely able to give us more input on where potentially we could tweak the process. But I'd really want to thank each and every member of the advisory committee for bringing their lived experience, their diversity, their organizational experience, and their own experience in the sector for so long. As you can see from the list over here, we had a diverse representation, and without them, we wouldn't be where we're at right now. And thank you so much, Jessica and her team, for leading the process so well. I'll hand it right back to you now, Jessica.
Super, thanks so much, Shalini, and thanks to you as well. I'm going to actually invite Rich Jansen, Executive Director of the Center for Community-Based Research, to share a little bit of background about the project, just to give an overview. Thank you, Rich.
Thanks, Jessica. And yes, I just want to give a quick overview of the project. And this slide summarizes the purpose of the project as to develop a regional accountability model for settlement. And so you can see at the top, the current model where we have IRCC, the federal funder, providing funds to local settlement organizations who then in turn provide services to newcomers. And those settlement agencies need to report back, and that's the accountability piece, with data back to IRCC. So that's the current model. And really this project is asking the question, what would it look like if that funding and accountability function would be located within local communities? And so on the bottom, you can see that red circle, a regional accountability model. That's what we're trying to understand what that would look like. If IRCC would provide funding to that entity, some sort of entity within Peel Region, who would then in turn directly fund organizations to provide services, and the reporting back, the accountability back from agencies would be to that entity, which in turn would provide data and reporting back to IRCC. So if that's what this project is about, the next slide is how we want to get there. And so you can see 3 phases over 2 years. We began with a short preparatory phase, setting up the advisory committee that Shalini mentioned and other things to get the project off the ground. And then we're now in phase 2, the environmental scan, trying to understand the local settlement reality within Peel, and also accountability models beyond. So you can see the 4 components of phase 2. We started off with understanding the newcomer demographics in Peel region, and then did a sector survey of settlement organizations within Peel, and many of you contributed to that, so thank you for that. We also looked externally, outside of Peel and outside of the settlement sector, to see what other types of regional accountability models currently exist. And today we're at that red dot, that community forum, and we'll report back on those 3 previous boxes, the newcomer data, demographic data, the sector survey, and existing models. And we'll look forward to the next step, which in the fall is a series of focus groups where we'll be asking stakeholders what they think about the current model, and more importantly, what could a future regional accountability model look like. And that leads us to phase 3, which is really the culmination of this project, where we will finalize that model. We'll have another community forum, share that with you and get your reactions and feedback to it before finally reporting back to IRCC and giving them our recommendations as a community. Through it all, we have regular advisory committee meetings, and we also want to evaluate ourselves internally, a process evaluation. And so at the end of today's meeting, we'll also have a moment of reflection.
Well, thanks so much, Rich. I'm going to turn to Cassandra now with the next slide, who's going to report back on some of that data as part of our environmental scan to look at sort of the state of newcomers in terms of Peel region. So thank you, Cassandra.
Hi, everyone. So as Jessica said, I'm going to take a look at the data here that we have in Peel. However, I want to root this in the broader context of the models. And so when we're building a model that's Peel specific, we have to be aware of our demographics in Peel. And unfortunately, the wave of the census that's immigration related is coming out next month. But we have done our best to try and make the data as recent, current as possible. So as you can see here on the slide, we have, rising totals of immigrants being admitted to Peel, or to Canada as well. A bit of a plateau, obviously, in 2020, but then a dramatic increase again in 2021 that's projected to continue to increase at a similar rate. So next slide. So here we can see the forecasts of the regional targets. So obviously, our immigration national level targets on the middle column here by year. And the way that we've calculated this forecast is because Peel receives on average 9.8% of the national level target. And so we've used that as a multiplier to get our forecast here. So obviously in 2022, we are anticipating by the end of the year that 29,000, nearly 30,000 people, 31,000 roughly in 2023, and then over 31,000 again in 2024. Next slide. So in terms of government assisted refugees, and as we know, we have government assisted as well as refugee claimants and privately sponsored. So this is only a piece, but a piece we have clear data on, that as of December 2021, we had, in rank order, Syrian, Iraqi, Afghani, and Somali as our top 4. But now we know that likely there's been a shift here where Afghans have risen to a higher place on this list. And we know also that many Ukrainians are arriving, though they are not government assisted refugees. This is a substantial population that's needing our support right now. Next slide. We've done some research on international students and the rising count of international students entering Peel as well on the right-hand column here. And we can see in this map where folks are primarily coming from. So there's a broader infographic as well we can circulate that delves into more of the challenges that they face. But we want to make sure that we're aware that this is a piece of the puzzle we have to consider when developing a regional model. Next slide. And so now we have a brief time for an ideas board. So this is a sticky note exercise to get us all thinking about some of the other issues that need system heroes, need support from the community. And so I'm going to share my screen now and present a sticky note exercise for folks.
Much. So this is an opportunity, since we're such a large group, for everyone to share some ideas. I know many of you work with newcomers directly, and so we would love to hear from you. What is a settlement issue or challenge that is arising that we'd love to bring to the surface, and is the particular newcomer stream or category, who is impacted? And we'd love to bring that up because it's a way to think about not just the issues broadly, but could the regional structure that we're considering contribute to benefiting, so that it's not just a regional system that works, but it's something that works for those who are maybe underrepresented, marginalized, or most impacted as newcomers. So we'd love if you can go to the link in the chat box, and then just on that, as you can see someone putting an initial sticky, just going to that green, the first green plus sign next to that first question, and that will allow you to put a post-it note with your, if you click on the post-it note, to type in your thought. If you see a similar thought, you can actually upvote and click the little plus button on that particular thought, and that can allow people to know that there's agreement on that particular thought. And we'll leave the right side for now. So just if you can answer that first question. And I know many of you have worked with some of the demographics that Cassandra just spoke about. International students, for example. We've seen refugees arriving from Afghanistan and other countries, but also the Ukrainian arrivals, where there has been some regional collaboration and coordination, and refugee claimants. So there's many different issues that we've discussed even as an advisory committee, and we'd love to bring those forward so that we can really think concretely about the regional accountability model and where there could be change that could impact newcomers directly. So we'll just give a few moments for that, and I'll find some thinking music to get us going. Great, thank you so much. Super. So I see lots of great ideas being added already. Feel free to keep adding as we go. I'm just going to go through some of them since there's, and it looks like some people might not be able to add. So perhaps adding it in the chat box is an option if you're having a lot of problems. But I'll just go through what we have already on screen. We're seeing housing as a key issue to start, housing affordability, and that is definitely underscored in many meetings that where we've been talking about different newcomers. Medical issues and access to medical supports by refugees. I think that is echoed by the mental health supports as well, and there's a few thoughts there. And thank you, Hala, for your thought about integrating in terms of learning English as well, and language services is noted. Labor market mobility and accessibility is definitely another key one. I think we're reflecting a lot of the functions actually of the settlement sector here, apart from housing perhaps and healthcare, but letting newcomers know about settlement agencies, that's another key one. So thinking about the outreach, where we're looking at really just a percentage of newcomers who know about settlement services, and how can we look at expanding that outreach and awareness. So just looking at, there's definitely a surge in volume of in-person settlement service demand. And we've definitely seen that articles about that, particularly for Peel region. And then just the stretched of capacity, staff are definitely seeing that at that level. The digital internet connection, reliability, service delivery, especially in rural areas, education, settlement in school, especially for Ukrainian speaking, basic needs, including food, is great to hear that highlighted. Exploitation of international students in housing and labor markets, lack of affordable childcare. This is really great, and really getting to some of the core issues that sometimes are not just issues for the settlement sector. I'm just going to flow to culture shock, youth supports. So some of the themes here are really echoed by previous sticky notes as well. So we're going to definitely hold on to these thoughts. So keep adding. This is fantastic. What I'm going to ask is we're going to move to the second question and really think about these issues and which are issues that could really benefit from regional planning and coordination and collaboration. Because as we think about a regional accountability model where there's a regional entity, as Rich described, that can fund services, could there be a regional level of responsibility where we can start to think about some of these issues at a regional level? So if you want to, again, just maybe use the plus sign next to the right side where it says issues to deal with together regionally, and add the same thought if you feel that that thought would benefit from having some regional conversation. Then we can start to think in our next phases about how to integrate some of these issues and whether it's appropriate for this kind of structure to tackle. Super, thanks so much. So I'll leave another moment for some thinking there. Super. So this is great. Hala, thank you for using the chat box. Can you maybe spell out SLAs for those of us who aren't aware of what that is? Thank you. All right. So in terms of what we have so far on the regional collaboration and planning and accountability, we have employment movement of qualified candidates across regional boundaries where there are positions available. So thinking about employment, that's great. Lots to think about there. And maybe thinking about also working with other regions. Transportation, mental health, lack of common client intake, really great point. There's a theme here around digital, around access and digital literacy, childcare, where we do have some regional work going on broadly, broadcasting information in different languages about settlement agencies. So again, more of that outreach. Thinking about increased coordination to help with the surge in demand. I think that addresses a lot of the issues in the previous column around the surge in service demand. labor market accessibility, income assistance, access to employment, cultural services, thinking about federal, I guess, policy around provincial pathways, planning and transparency, and immigration targets. Great, that came up at our advisory committee as well. So again, some of the information as soon as people arrive at airports, that's a great point. Coordination efforts around employers, around their needs, working to address employment needs again, which is great, and integration, effective integration with the community. Well, these are all excellent. So thank you so much for this exercise. Feel free to continue to add. We're going to take this back and synthesize this as we think about the model development further. So thank you again. We're going to take this to the slide deck now. So we'll do a little shift back to that to keep our discussion moving. And we're going to actually share back some information with you around a baseline survey that was conducted. So I'm going to turn it to Cassandra to present on that.
Yeah, so firstly, thanks again, everybody, for completing the survey. I know many partners put a lot of time and effort in. We actually had information sessions that people attended to make sure they gave us the best quality, accurate data. And so we know this was like an hour of your time likely. And we're really, really grateful, and we want to share back with you what we've learned. So next slide. So just a broad sense of the purpose of the study first. We were attempting to construct what is the existing model regionally and sort of federally, as currently IRCC is managing funding and governance. And so we asked questions around funding, but also around some of the social networks that we use to coordinate, and the governance structures and some policy as well. So we see here that we had a total of 28 IRCC funded settlement agencies in Peel, and of those 28, we had 18 respond and complete the survey, and 4 of those are Francophone. So thanks again, everybody. Next slide. And so, as I just mentioned, the goal is to obviously understand the funding and governance model that's existing, and these are the 4 categories that we really took a deep dive into looking at through the model, through the survey. So next slide. Of the agencies that did complete the survey, we have mainstream agencies with specific newcomer services, as well as ethno-specific service agency, the settlement agencies themselves, and then the other category is 2 school boards as well as 2 health service providers, and then 1 that's economic development. Okay, next slide. So this chart is looking a little complex, especially at first blush, but I'll do a bit of an explanation here. So along the bottom horizontal axis is the number of agencies that indicated that they received funding through this stream of IRCC funding. And so you can see along the bottom as well, the amount of funding is color coded there. So not only are you seeing the number of agencies, but also the total that they received. And so why is this beneficial when we're thinking about a regional model? Because we look at this mix and we know this isn't a complete picture. We're missing 10 agencies here that do receive IRCC funding in our Peel base. But we have a bit of a sense here of where the funding lies and kind of what services are being provided that are IRCC funded currently, right? And so if we think, you know, more agencies need to be doing needs assessment and referrals or less, more agencies need to be doing orientations, right? Ethno-specific, for instance. These are like this is the baseline where we can start to think about these questions objectively. So as you can see here, for instance, I'll just talk us through one. So language training and skills development, the yellow portion indicates that there are 2 agencies receiving between $200,000 and $300,000. And then the blue indicates that there are many receiving over $500,000. So it's a larger allocation. Next slide. So in similar format, we're going to go through at the federal, provincial, and regional level. And this is beneficial in two ways. One, in thinking about how we construct our model at the regional level, though we're not really obviously going to be able to change, or funnel funding through Canada Heritage or employment and social development, for instance. We are going to be aware of sort of what the funding mix is in Peel, and we can think about if there are ways we could fill some of these gaps. But also an additional benefit is if your agency is seeking funding, look at the screen of funders here and see who is funding Peel already, and who you might be able to approach, and who's essentially where are we having luck in acquiring funding. And so as we can see here, obviously at the departmental level, Immigration, Refugees, and Citizenship Canada is funding the lion's share of settlement agencies, which isn't surprising, followed by Employment and Social Development. And then it looks like Women and Gender Equality is number 3. So then obviously looking at that color coding, it follows a similar trend where those same 3 departments are funding over $500,000 for at least one, if not more, agencies. Next slide. So Provincial Ministries here. These are all of the ministries that settlement agencies indicated they receive funding from. And we see that the 3 major funders here, obviously the Ministry of Labor, Training and Skills Development at both the global and the local level, as well as the Ministry of Health. And so just when you think about funding at the ministry level, at the provincial level, think about where the funds are coming from here again. Next slide. So here we are at the regional and municipal levels, and the Township of Caledon, it isn't that they didn't provide any funding, it's simply that we just didn't get participation from a Caledon-based agency. So don't assume that they're not funding from this picture here. But the region of Peel obviously allocating the lion's share of the funding at the regional and municipal level. So thanks to our funders. Next slide. So we also asked about targeted funding. So we wanted to know whether agencies were receiving funding for particular population groups. So obviously along the bottom axis are some, target demographic groups. And what we found was that many agencies, 12 in fact, were funded to provide newcomer youth focused programming. And then for children as well, 9 of the agencies were receiving specific targeted funding for newcomer children, which is good to see. So you can also see some of the gaps here, though perhaps the demographics of incoming newcomers reflect these gaps. So LGBTQ, as well as persons with disabilities at the lower end, with only 3 agencies each receiving targeted funding. Next slide. And so then we thought about pathways and whether agencies were, seeing or receiving funding for specific pathways more than others. And so what we saw was, everybody is serving permanent residents who was surveyed. But we also saw that GARs and refugees, the majority of agencies were focusing services on this population. And then refugee claimants to a lesser extent. Many indicated they were supporting students, and with the caveat or the asterisk here that I think there isn't necessarily clarity that these folks are on a study permit currently, like international student, as we would think about on a student work visa versus international students who maybe emigrated when they were younger, but are still adapting to Canadian way of life. So that's a brief synopsis of some of those pathways. Next slide. And finally, this is the big picture of the current existing model. So we have the various layers of government. With the dotted lines, we see the various tables and committees that are formed to support sort of planning and newcomer networks. And then the blue lines indicate funding and funding flows on the left side. And then on the right of the settlement agencies, we have non-IRCC funded organizations that support newcomers. And so these would be, faith groups or ethno-specific groups that do some of this settlement related work, but have yet to receive IRCC funding. And we want to include them here because they do important work as well. And on the right-hand side, coming up, the upward facing arrows, you can see the data flows. And so the settlement service providing agencies consolidate data using the databases like iCare. That data flows into IRCC and then is released to Statistics Canada and ultimately goes into the longitudinal immigration database. There's a settlement module. So when all is functioning well, that's how we access data through that data set. Now, next slide. All right, I'm going to transition.
Maybe before we move on, we can go back a slide and just ask if anyone has any questions. We have time for questions as Cassandra's gone through a lot of information and lots to digest. So Shalini, go ahead.
Question. Oh, sorry. It's actually a comment. When I look at this chart and I see the provincial government and the arrow going downwards to employment-related service, etc., that's fantastic. And they do support immigrants in many respects, right? However, we're working on a project right now. And what has become apparent, and I think most people in this room already know that, is that those programs are limited. So yes, immigrants can access a lot of them. But there's a lot of individuals who come here, including international students, and some individuals with open permits. So there's different categorization. So they're not permanent residents, they're not immigrants. They are excluded from a lot of this programming. So what essentially ends up happening and is becoming apparent to us is that right now, especially the way the labor market is, there's a huge need for a lot of workers. There's an appetite on the side of employers to embrace these people. There's an appetite for these individuals who are stuck in not being PR or immigrant to work as well, to go through this program and actually connect the pieces with the employers. But unfortunately, they cannot have access to the programming. So when we look holistically at the whole system, there is a huge need for employers right now to get good candidates to fill positions that are going unfilled and their bottom line is hurting. There's a huge appetite for individuals who actually want to be that fix, but the system is limiting them because they don't have access to this particular program, so they're excluded from that. We have an ideal opportunity where we can match employers with the right candidates. Unfortunately, we're limited because of accessibility to different programs that the province funds. Their criteria is very limiting to those individuals who could potentially fix the situation right now. And I'm not saying it'll fix everything, but absolutely it'll begin to fix the huge need that employers have right now.
Thank you so much, Shalini. And you have a great regional view of this. So this is where a regional structure, some of these thoughts and concerns over accessibility to programs and some of the bottlenecking could be raised. Dinesh?
Thanks, Jessica. And thanks, Shalini. You raised a pretty good point that on the one side, there are employers that are looking for these candidates because of labor shortage. And on the other side, we have these international students that cannot access these programs. And so we need to find something. Long story short, we at BMG are currently developing a lot of programs to support these international student community. In fact, we are in discussion with a couple of colleges, including Sheridan College, approached us on how BMG can support these international students in getting the skills that they need to become the employment ready. But here is my challenge: as BMG is not funded by anybody. All the operations that BMG is currently doing it is through the personal resources of the promoters of BMG. Okay, all our funding applications have been rejected. So here is an organization that people want to contribute, people want to support the community, but you can't do it empty stomach. Mm-hmm. Okay? So what can we do? How can we do? I mean, and I'm going to be very transparent. More and more industry professionals are coming to us, adding their saying that we want to add our expertise into the work that you are doing it, but we still need money to develop these programs, to scale up these operations that we are doing it. So looking for guidance, looking for advice, looking for help, and how we can get money to scale up the operation. We are committed to support international student community, and we will keep doing it. So just my 2 cents.
Thank you, Dinesh. And I think your concerns of resources for non-funded organizations are represented on this chart. Your contributions among other groups are appreciated and provide some food for thought around what a regional accountability could mean for groups who are not currently funded and contribute to key issues.
I'm going to tell you, Jessica, just one last thing I want to add on to it too. In the last 2.5 years that BMG has been in operations, the promoters of BMG have spent more than $50,000 from their personal resources because they have a passion to serve the community. But how long can we keep doing it? You have a passion, but you don't have the money. So 50,000 is a big amount for spending from your personal pocket to support a community cause. Okay, but we still need help to get the funding so that we can scale up the operations.
Great, thank you for articulating how deep that goes. Thank you. Marcia?
Thanks, Jessica. This chart is wonderful. I mean, it's just great to see how everything is connected. I just, for the purposes of the database reporting piece, I just want to mention here that it mentions OCAS's CMS reporting into iCare, or as one of the database tools. But I also just wanted to mention for significance HEARTS, which is used by all of the language training providers as well. And that's a critical database reporting system that supports the sector within Peel and across Ontario. Thanks.
For sure, we can.
In the survey, and we definitely captured data on HEARTS. I don't know how it fits into the IRCC reporting to StatsCan, which is why it isn't on the chart here, but we do have data on that. So thanks for bringing that up for sure.
Thank you. So yeah, just to share that we do report from HEARTS directly into iCare, and for Ontario, it is required for Peel in particular, since that's the focus of this group. All of the data for language training assessments as well as training providers, that's all rolled up into HEARTS and then reported into iCare.
Thanks, that's really helpful.
We can definitely update this image with that information. Thanks, Marcia. Super, and there's some comments in the chat box around thoughts around data and reporting. So thanks, Kim, for suggesting some of the databases that are widely used and could provide some support for the data to be used by the sector as well. And Gurpreet added around employment that there are some, I guess, nonprofit agencies and the need to improve second career to upgrade towards ensuring that those with degrees and work experience can be best suited to employment that meets their experience. Thanks for that thought. Great. Anything else that anyone wants to add? We'll also have opportunity to think about the current structure as well as possible shifts as we think about the newer model elements that have emerged through the literature review. So I'm going to actually turn to Ruth, if that's good. And thank you so much, Cassandra, for that wonderful overview of the results from that in-depth survey. So Ruth, I'm going to, here we go. I'm going to pass the torch on to you.
Great, thank you. So yeah, now that we've had that look and kind of initial chat about the existing model, we want to explain to you all what we mean by regional model. And so the next two slides are a product of a review of existing regional models in Grain academic literature that we did as part of the project's environmental scan. And in the policy literature in particular, regional approaches to system planning, accountability, funding are generally presented in the literature as more efficient, equity-based approach to planning and funding because it allows for an enhanced stakeholder participation in ways that contextualize decision-making and local reality. So that, and the policy literature, that is the kind of theoretical explanation of it all. So in contrast to the current model that was just presented to Cassandra, a regional planning and accountability model is more horizontal in its decision-making structure and collaborative in its approach. In this model, IRCC enters into a funding agreement with a regional entity that will facilitate planning, set priorities for settlement in the region. This model will also determine how funding is allocated in the region, who gets funding and how. And this is done in collaboration or close consultation with not only settlement service organizations, both IRCC and non-funded, non-IRCC funded, but with other key stakeholders in the region, like the private sector, people with lived experience, Indigenous leaders, and other community partners like libraries, education, folks in transportation, policing. Our project, this process is meant to think about what this regional entity will look like. And the box at the bottom includes a list of elements that were identified as the most common features or the most common elements of a regional model in a review. And I want to take a closer look. So let's go to the next slide. So as we co-design this model, we will want to think about what is the model's mission and mandate? What is the model's purpose? What's our goal? What are we trying to achieve? How is funding? We'll think about how this funding is allocated through this model. We'll think about the accountability and governance structure. So how will the system be managed and by who? The model will determine how services are coordinated, and this may or may not include a coordinated access system. The model will facilitate information management and reporting. It will oversee monitoring and evaluation. And finally, we will want to think about to what extent and how the model will promote and facilitate stakeholder engagement. Okay, so I'm going to go to the next slide. We want to break you out in groups to discuss this. I'm going to share but before we do, we want to check and do a quick pulse check around giving you time to reflect on the current model that you just discussed through the lens of these elements, I think is what we're trying to achieve here. And so I'm going to put a link in our chat. It's a direct link to a Mentimeter. Hopefully everyone can get it. And then I'm going to share my, oops. Sorry, pardon me. Yes, here we go. And I'll give you a moment to go in there while I share my screen. Here we are. I'll give you a few more moments for people to access the link and start voting. So what we're asking you to do is rate your satisfaction with the following elements of the current planning and accountability in the Peel region. So we're asking you how the settlement system is organized, how satisfied you are with the way it's organized and governed, the way funding decisions are made, information sharing, reporting, system planning, stakeholder engagement, collaboration, and evaluation outcomes. And so we're getting a very interesting around a 3 mid rating throughout. Does anyone have any reactions or comments about what they're seeing here before we go into a group discussion? Okay. Sorry, yeah, I've lost sight of who, if there are any hands up. My apologies.
Oh, no, I don't see any hands so far. Just wanted to mention that these elements reflect the same model elements that you just walked through. So I'm thinking about those model elements with the current structure, which is great.
Well, I'm going to stop sharing and go back to our slides for one moment. So keeping that in mind, keeping this reflection moment in mind, and if I can ask us to go back to our own slides. Wonderful. And we can go to the next slide. We want to break you out into groups. And And I'm going to put another link, and I know you've been bombarded with links in this session, but another link to a Jamboard presentation. I'll give you a moment to open that Jamboard. And it's this Jamboard is just for your reference. So that as you're going into small groups, you have the slides that you've just seen available to you, as well as the questions available to you. So this here is what we want you to think about. We want you to think about two questions. What is in relationship to the models that you've just seen? What is working well in the current model? Excuse me. Which elements of the current model should continue in a regional model? Thinking that through. And what is not working well in the current model? How can we address those concerns in the new model? So just to take you through the journey, look, we've explored the current model, introduced elements of what a regional model can look like. And now we want you to think through what is working well in the current model and what we can in relationship to our movement, our journey towards a regional model. Is that clear? Great. So I am going to break us out, randomly assign us into groups. Welcome back, everybody. We're very excited to hear how your small group discussions went. People are still trickling in, just making sure that we're back to our full group. Great. So, and some of you have already started filling it out. So I'm putting in the same direct link to the Mentimeter we put out before. I'm sharing my screen again so you can see everybody's what everybody is. So now that you've had some time in small groups to talk about the current model in relationship to these elements that will travel into the regional model, we want to know how receptive are you to a potential shift from the current model of current settlement accountability model to a regional model. And here we go. I'll give folks a couple of minutes to fill that out. Again, the link is in the chat if you're kind of just getting reoriented.
We can see in the bottom right corner there that 16 of you have already completed the poll. So thanks for that. And we'll just watch that total rise.
How receptive are you to the shift to the regional model? We're at 21. I'll give it folks a couple of more seconds, and then I would love to open it up. We're seeing that people are somewhat receptive, the majority of folks.
Thanks for your comment in the chat, Dinesh.
Dinesh, very receptive, Dinesh, thank you. Okay, so I'm going to stop sharing. I would love to hear back. So most of you, after talking about it, after thinking through, reflecting on the current model, after having a discussion about the current model in relationship to a potential new model, most of you seem somewhat receptive of this shift. And I would like to open it to the floor for the folks who agree to report back, to give us a sense of some of the things you talked about, and maybe giving us as a group some context around why you're receptive, somewhat receptive, very receptive, not receptive. Can I open it to the group? Who would like to, do I have hands?
Oh, Michael Simon.
Great. Thank you, Michael, for starting us off.
Oh, no problem. Look, I just want to apologize to my group because I really had nothing to share. I just started working with Achieve as an employment coordinator in August. So I just my purpose for being on this call was to try to get an understanding of some of the issues that were prevalent in the Peel region. And based on the discussion, it seems like it's the same issues that are throughout Ontario. I recently was working in the County of Wellington for about 17 years, so it's similar issues and challenges that we face. However, my group, Dinesh, Michelle, and Angela, they were able to provide me with a lot of information that I would look at supporting the regional planning accountability or see the benefits of doing that. Just based on some of the conversations around the work that some of the organizations who are currently not receiving funding, but they are understanding from a community perspective that there is value in those organizations. So the regional model will be able to identify that and provide adequate funding to be able to allow them to continue to do the great work. And then from a frontline perspective, I believe that there's the individuals who are working directly with clients have a great understanding of what the issues and what the challenges that some of these folks in these communities face. So being able to have that direct, I don't see it in the model, but it would be great to have a direct stream from frontline staff directly to the regional planning accountability piece to be able to filter that information in, to be able to make decisions and things like that. So that's basically, sorry, again, I don't have all of the specific details, but thanks again to my group for educating me on the challenges in the regional municipality of Peel. Thank you.
Thank you, Michael, for that summary. I really, really appreciate it. I'm going to hand it over to Shalini, my apologies.
Yeah, I'm a little bit like Michael. I was more the observer, so by default, I became the note taker. Sylvia and Lisa, representing one was from NCP, one from Catholic Coastal, so who had wealth of knowledge, and what they pondered on what's working well. That they seem to be seeing a lot more collaboration and partnership happening amongst agencies. More information is being shared and emerging issues are being handled better as a collaboration versus individually. The model seems to be good for the most part. What they did see was that for settlement, to better accommodate secondary migration, very often there's individuals who've been here slightly longer and are immigrants, but they still, when they move to a new community, they still need that support, but that group is being neglected. And this also includes the international students, temporary foreign workers, and a few other groups that they felt. What they pondered on was not working well. It's very reactive. And the short-sightedness in the scope of when actions are taken as far as what needs to be done. And this could be true of any group of refugees that have come recently. So they react to it and they do it, but they don't engage the stakeholders as well as far as what else could be done. So very often they're juggling with taking care of a current load of refugees who are not, I think one of them used the term, the trending group right now, whether it's Ukrainian, whether it's Afghanis. They still have a load of individuals they're taking care of. And what ends up happening is there's some resentment from older refugees to say, well, okay, now, so we're not the flavor of the month, so we're being ignored. So it's got to be more robust. They felt that the new model could include service providers to respond to emerging needs and how to balance resources to make sure that everything is being catered for. Yeah, I think that's pretty much it. I don't know if Sylvia or Lisa want to add anything I might have missed over here. No.
Great. Thank you so much. Is there any reactions to the two folks that we've heard from, the two groups we've heard back from so far?
It's Martha from the Peel board. I'm going to comment on Shalini's comment about, the flavor of the month, because that comes up a lot, when the Syrians, influx of Syrians came in, and now the Ukrainians, and why are they getting the money from the government? When I got here, I didn't get anything, those kinds of comments. So it's trying to be equitable among all of the newcomers and making sure that they are able to access the services. When our government's, I don't want to use, throwing the money at certain groups, you need to fill the quota for those groups if you're a community agency that's getting specific funding. So I know we've been fortunate to collaborate with some agencies that are at the table today that I want to identify, and saying, okay, well, we'll give you, 10 Syrians if we can add 5 others into that workshop that you're going to offer. And, it's worked well in the collaboration to both meet the numbers and to meet the needs of the students that we have. So sorry, just realizing my video is still off. And so it's nice to be able to collaborate with the community agencies to identify those, but I hear that frustration from the students that we have in our different programs. I don't know, do you want me to jump into some of the things we talked about too?
Sure, love that.
At the same time. One thing that we did talk about is the collaboration and that it works well for the quarterly collaborations within the different groups for labor, orientation, community connections, and language services. But sometimes I think that the collaboration is great at a higher level. And I think, Selene, you may have mentioned this, or that sometimes it doesn't always filter down to all the frontline workers. So making sure that everybody knows what those collaborations are, because Peel's huge and it's just really hard to know what everybody else is doing and to be able to refer to the wonderful programs that everybody else is offering. That said, we had some discussion that the newcomers or immigrants will come to our agency with a lot of different needs presenting, but that agency is only funded to look after 2 or 3 of those needs. So then it's like, okay, well, I can help you with this, but you've got to go there for the other stuff. And yesterday's workshop on the health needs and just looking at, the nurse practitioner model and, that one-stop shop would just be ideal in so many ways, but our agencies and our funding are not designed to be that. So how can we provide more wraparound services? How can we continue to work collaboratively together to make sure that we can address all the needs that our newcomers are presenting? It's just so frustrating to say, well, I can help you with this little piece, but if you want to go here, I'll have to send you on a bus across the city to access the next level. And the wait lists. We talked about the wait lists and the wait times for mental health services. And we talked about some of the gaps that present themselves over time. So some of the immigrant groups that have been here for many, many years, and you can tell where their needs weren't met along the way. And how can we go back and make sure that we're still addressing them? I think I'll stop there.
Martha, thank you so much for your contributions. I really appreciate it. And I don't want to put you or your group on the spot in any way, but you identified some really key and important issues. And I see a lot of nodding heads. So a lot of that seemed to resonate. And I'm wondering if you were able to move your conversation to discussing how some of these issues could be addressed if we adopted a regional model. And I don't know if you were able to push that conversation, but I thought, for instance, collaboration that goes down, that's happening at a high level. How will a regional model allow it to travel down? Wait lists. Any discussion around that in your group?
We identified more needs than the discussion of that. Yeah. Some people at the table are already on those collaborative, those discussion groups. Right. So in some ways they mean, they're getting that information. Even just, I try hard to keep up on what's happening in our community, but to sign up for all your newsletters and to be combing Twitter every day, it's a lot of work to know what everybody else is doing. How else can we do that better? Right.
Thank you so much. Any other comments? And I also invite my team members, if they have any probes for the group, to jump in. Agnes, can I go to you?
Sure. Hi, everyone. So very great points, Martha, and your points about the one-stop shop, about the collaboration, they're amazing and there's so much needed. Our group also talked a little bit about the opposite, so the overlaps. So there are newcomers who are actually circulating and accessing very similar services that are funded by IRCC. and they just go from one agency to the other. So that was another point that we have raised. So maybe something that is not working really well with the current with the current model, where we should be seeing more, service collaboration or streamlining or something that would actually allow us to monitor and control how newcomers are accessing services and what type of services they're accessing. So there's no double dipping. So they actually, are not trying to access multiple service providers funded for the same streams, whether it's needs assessment or community connections or information and awareness services. So that's something that we discussed within our small group as well.
Thank you so much for adding that overlapping and double dipping of services. Any reactions or new concerns with the current model that we can think about in our vision of a regional model? I'm going to check in with the chat. Prasad has said regional model will work only if it is accompanied by population-based funding. Prasad, not to put you on the spot, but would you mind elaborating on that?
Yes, definitely. Thank you. And what I mean by that is Peel is holding the largest international airport in Canada. And we are the receivers of majority of the newcomers that coming in. And we are the settlement place for majority of newcomers. So if we don't consider those aspects and the amount of resources that's needed, and we develop a regional model, then what happens, the history tells us that, the total resources will be divided into these regions in one way or the other. Doesn't make any sense. So historically, Peel is disadvantaged by these funding inequalities. So, 1.5 million population, and we still get very, the short edge of the stick all the time. So anytime we agree to move into this regional model, and in paper, it looks really nice that, okay, there is a lot more regional autonomy. The smaller agencies and the other agencies who work here is going to get more resources. But in reality, the entire resource pool will be divided into different regions in Canada. And then the federal or the provincial government will probably say, you only get this %. That % doesn't make any sense because sometimes, larger pool, we can argue based on population, we can argue based on need. When it moves to regional, if you're not careful, then our hands get tied, and then we will still see the challenge of not having adequate resource to support families. The one point that I think just before me, someone was talking, I forgot the name, sorry for that. The newcomers moving, I think it's from Achieve. The newcomers are moving from one services to the other. There are two aspects around it. I was a newcomer 25 years back, and I have to be very clear when we make these generalizations around why the newcomers are moving from one service provider to the other. So there is an introspection that's needed from the service provider space too, that why are we unable to accommodate that need, rather than placing the blame on the service recipient, because maybe it's the service recipient feels that the service provider is very large, or maybe there are more bureaucratic arrangements being there. There isn't that connection that the service recipient is unable to develop. So just want to point out that, rather than painting a kind of like a large space saying newcomers are shopping around for service. There is other side of the story too. That's it. Thank you.
Thank you so much. I see, Angela, your hand up, but I know Jessica had her hand up before and wanted to give you a chance. No, okay.
I just wanted to highlight Prasad's comments because he was in my group. So, I'll turn it to Angela. Thank you.
Hi, hello. I echo everything that Prasad just said, and especially the last point, because we are not a settlement agency, Roots Community Services, but we do get quite a few people coming to us 6 months after they've landed here. and reason they weren't getting culturally appropriate service that they needed. They weren't getting the type of the requirements met that they wanted. So they ended up having some issues and coming to us, not for settlement services, but because they have their needs weren't met. They either have no mental health issues or they need other services provided through one of our many programs. So I think we need to be sure when we're providing the service that, yes, are we really meeting the needs, or do we need to refer to someone else that is able or capable of giving the services that that person needs?
Thank you, Angela. Appreciate that. And Martha chimed in to say it's not always negative to go to another agency. She agrees. Something may not have been meeting their needs or even personality of workers. Any other comments? So I see Arish, your hand is up, and then we can go to Jessica.
Thank you. I was with Miriam and Kim from Tamarka Institute and from HMC, and they've assigned me to report on our comments, and a lot of them overlap with what everyone else has shared. So I was waiting to the nearer end to share them. But some of the concerns were basically around newcomers accessing services and their knowledge of what settlement services are available. And one comment was that a lot of the time newcomers arrive at the airport and there are information sessions on the spot, and it seems like such an inconvenient time for them to learn about what's available, right? So that kind of feeds into what kind of settlement services they would access firsthand before learning more about what's out there and maybe adjusting or shifting to another organization to get the services that they actually need. And that also happens, which feeds into another comment too that we discussed on how settlement services are prepared to handle large influx of immigrants arriving. One example was given around when Syrian refugees were arriving. They were a little unprepared to handle the service provision for large numbers, but then some of the learnings were implemented to handle the next large numbers of immigrants, like the Afghan refugees. And so learnings used from previous experiences have been used for later settlement service provision, which kind of might explain some of the reasons why services aren't matching too, right? Because of the way that planning and experiences feed into later developments and certain settlements provision. Another comment was, and this one feeds into how we want to think about funding allocation and equity in terms of funding and resources. Some of the concerns were around having influential or more influential organizations sort of influencing the direction of funding and dominating resources and such, and how that would look like, or how that is addressed in the regional model. The other thing is that how are we to address the demand for non-IRCC funded organizations? And how would there be funding sustainability for such organizations to be able to provide service provision? And the last point was, how does this new regional model reflect the voice of newcomers and feed into the process of planning and reporting to IRCC? So how would the voices of newcomers and their experiences reach IRCC in the reporting data and be basically to represent their experiences and concerns? And if I missed anything, Miriam and Kim, please come right in and you can talk. Thank you.
I see a thumbs up from Miriam. Kim is not on my screen, so give her a moment. Give them a moment. Great, thank you. I'm going to hand it over to Jessica. She had her hand up.
Sure, I just wanted to make some linkages in the theme of the client access to different organizations. It links back to a Post-it note around intake, and just thinking about that might be a way to look at a regional collaboration on that aspect, but also thinking about, Ariz, your last point around understanding the client's journey and any feedback. I think that's another element. So at the kind of the start of the client journey and the end, to really give the sector an understanding of the needs as they arise. I also wanted to bring up something Prasad brought up in my small group. We discussed a lot about international students and temporary work permits, and sometimes in his role, he's seeing also that the families, they're coming with their children, and so sometimes the needs of the children are not actually supported in the same manner in terms of thinking of some of the needs. So something that is going well is, for example, with the Ukrainian arrivals, a project that he's collaborating around unaccompanied children. So that's with IRCC. So just mentioning that in terms of thinking comprehensively of the new arrivals as well as their family members.
Thanks so much, Jessica. I'm going to, because we've been quite rightly focused on like a lot of the issues, the gaps in the current model that should be thinking about as we move towards a regional model. I do want to leave some space at the end of this conversation to flag or make note of things from the current model that we want to carry with us to the region model because they're working well. But before I do that, I do want to give folks a chance to continue this conversation and put out any more challenges and gaps. Well, yeah.
So our group really focused on talking about kind of the accountabilities as service provider organizations that we have around managing the budgets, just because that just happened to be who was in our room. And one of the things that really, I'm just going to talk about a theme about what we talked about, is that we want to ensure that there's responsiveness in the financial support. Sometimes needs change rapidly when you're responding to needs in a community. And so what we liked about, in some ways, about what's happening now with our funding, as long as it's within the budget that's existing, there were sometimes some flexibility in how you're able to respond. So for example, with the influx of Ukrainian visitors, being able to fund positions if there is slippage, or manage within a budget to hire additional positions, let's say, for example, that might service the needs of those clients. So that's important. But what the current model doesn't allow for is a quick decision on sometimes the emerging needs that may come up. So in our group, an example came up that, once they were working with school-aged newcomer children, and that once September hit, a whole set of new needs came out, and that it will take months and months and months for them to get any kind of responsiveness under this current model in order to have the needs. And the feedback is there's a ceiling to what the funding is that we're able to provide, and the cycle of the way funding works. It can be somewhat prohibitive to responding to those immediate needs that come up, that they may look for that flexibility on. So, there was an appreciation for longer term agreements, that is something that if we're doing the regional funding model comes into place, that I think that comes down to a desire for stability in some ways in the funding, but at the same time looking for ultimate flexibility to match the needs of what's going on, being community or being locally responsive and having timely responsiveness as well.
Thank you. Any reaction to that? Any other kind of challenges or gaps we want to identify? Okay, so I am then going to give you a moment to think about what's working really well. Like, what do we want to make sure we're going to carry with us to the new model, to the regional model, if it happens. Paula?
Sorry about that, but I just remembered or thought of a gap that children come to Canada often with education gaps, and I don't think there is enough funding covering or addressing this issue. I know it's has to do with the Ministry of Education and schools and all this stuff, but maybe it can be addressed to IRCC somehow. that children that come, they have sometimes finished, for example, grade 3 in their home country, and then they are, stranded around the world, and then they come here after 3-4 years with a gap that I have noticed is very, very hard to make up for. I don't think there is enough funding to cover that, including English language for like ESL for kids, for younger kids, our school age kids. So I'm not sure if IRCC can address something like that, but I just thought of mentioning it because I see it very often.
Thank you so much for that comment. I'm just reading Judy's comment on your suggestion, saying she says this is a good suggestion. Perhaps there could be funding to nonprofits for tutoring programs. Thank you, Judy, for chiming in. Okay, we need to wrap up soon, so I do want to, again, I'll throw it out one last time. Things that are working that we want to carry with us, or you can think about, are there things that the advisory committee we should all be thinking about throughout the transition from one model to another? Is there anything you want to flag around transition? I can open it up to my team members if they have any last comments, wrap-up comments, or probes before we go. Oh, Shalini.
Yeah, I just want to echo, when we look at the transition for employment services in Peel, because we're a service system manager model right now, and Halton, we're just starting that process. Fast forward Peel today, which is almost like 1.5-2 years into the process. As far as we're concerned, there's a huge gap in as far as how they collect the data when they transitioned. So for us to really make any comparisons of how well things are doing, there is a huge gap. We typically get data from the ministry, and right now there's some gaps in the data that was collected. So uniformity, so in future, when we want to see how the new system's working, we can compare apples to apples. So this is just a reflection on what we're facing right now with the gap in the data. For Halton, we're okay, but as Halton also transitions, maybe there will be a gap. And I recognize that they're collecting the data, but we're not getting it. So it's a problem, and make sure that that is done very efficiently, because that data really feeds all of us to say how well things are doing or where the gaps exist.
Thank you, Shalini. And Kim is adding on fairness, equity, and evidence-based decision-making. Before that, Martha said that MOE needs to do a lot more funding for ESL, ASD, skilled-based learning. With another comment to say that we've been fortunate to be so large geographically in population, which often means there can be duplication of services and still have some ongoing without. And then I'm going to give it to ask Anita to chime in, and then go over to Rich, who will probably wrap us up.
Thank you very much for this opportunity. I'm curious to see what the future holds for the settlement sector. But what I'm thinking in terms of way forward, a lot of discussions are happening, and we need to look in terms of our funding streams and what it limits us to do. So in terms of, I'm curious to know, I know maybe it's too early to say, would the regional model impact on the settlement agencies in terms of capacity and what we will have to do in the future? Because if we are looking to do a centralized type of model, obviously it's going to impact on the agencies. So I'm just curious to know. Thank you. If it can be answered, thank you.
Just to chime in, Judy has asked the same question: how will the new entity impact the current funding streams? And it's actually quite exciting to see folks thinking this way and asking these questions now, so that as we go into consultation. but also our current funder stakeholders in this discussion. I don't know if anybody from my team wants to chime in there.
I'll just mention that IRCC has started this consultation project through the local immigration partnerships. There's about 15 across Canada, and their focus is on IRCC funds. However, they're open to our consultation project, including consideration of other funds, such as the provincial funding, as well as regional funding. So we will be involving and engaging in more depth funders in this project to consider the entity and what that will look like, and various roles that current regional funding entities play. So not just governments, but also other funders as well. So I think that there's more to come on that conversation, and in terms of implications for service organizations.
Thank you, Jessica.
Rich, did you want to?
Yeah, I just have a high level reflection for what it's worth, and I really appreciated the healthy dose of realism in this conversation. People recognizing that, yeah, there are many things of the current system that aren't working that well, and that we need to be aware of them. And yet also, let's not rush towards a new regional model and think that just the idea of a regional model is the solution, but let's be thoughtful when we're doing this. And particularly a couple of things that I've kind of noted is a regional model needs to be nimble, not reactive. It needs to be precise in who is being targeted as beneficiaries, and much more collaborative. And it needs to be equitable in making sure that that newcomer's voice is a part of that accountability, has direct channels to that entity that is hosting that accountability. So there's work ahead to do in drilling a little bit deeper as we allow ourselves to think creatively of the future, to make sure that we're aware of what currently is not and is working well, and to propose something that tries to be as comprehensive as possible, keeping in mind this nimbleness, this precision, and this equity as some of the guiding principles.
Thank you. Hala has asked to add on, I wanted to add on that non-funded organizations, we are offering a lot of services, but we're not getting the support needed, whether financial, informative, or training related. I think she did not want to get that lost. Thank you so much, Rich, for wrapping it up that way. And I think your summary is also kind of really teased out this why folks are somewhat receptive, right? Why we're kind of we're collectively overall, we're thinking we're receptive, but somewhat receptive. So I'm going to ask Shreya to share our slides again, starting at slide 27, I think it is. Thank you. So we're going to, now that we're here, we've had these initial thoughts. I want to give to people what an understanding of how community can be engaged in the co-development of a regional model, and like point out opportunities where you can contribute and when you can contribute. Can we go to the next slide? Thank you. So to start, how can you contribute to the development of a regional model? Anyone in Peel can attend our community forums. Encouraging folks to save the date. The next forum is on May 19th, 2023 at 9:30 a.m. Community, if you're a member of a community partner organization, for example, if you're from education, transportation, you can participate in a survey about your organization. And Cassandra has mentioned that broader sector survey earlier. And I think what we really want to highlight here today is that there's an opportunity now for you to participate in focus groups. We can go to the next slide. Focus groups, who can participate in our focus groups? We are happening over the course of the fall, hoping to wrap up in the winter. So you can participate if you identify as a newcomer living in Peel Region. We'll have a series of focus groups in which we hope to hear from newcomers. You can participate. You can participate if you're a frontline service provider working with newcomers in Peel. Focus groups dedicated to that frontline perspective. We will also want to have focus groups with EDs or managers of settlement organizations in Peel, both IRCC funded and non-IRCC funded. And then finally, much like the survey that we're just about to launch, we're going to have some focus groups with representatives from community organizations that serve newcomers tangentially. So libraries, transportation, education, and police, and from policing. What will we talk about in these focus groups? So a little like today, but in much more depth. We will spend some time collecting your assessment of the current model. First, creating a picture, a real picture, a picture grounded in your experience of what the current model looks like, and then unpacking it in a similar way around what is working and what is not working. And then a big chunk of that focus group will be dedicated to your vision for a regional model. What is the change you want to see? How do we transition from this current model to a regional model in a way that makes sense and won't impact the quality of services we're providing? How will this affect newcomers? This regional model, thinking thoughtfully about how a regional model will affect newcomers and how we support them. So next slide, please. How can you participate in a focus group? So tricky, we have a community feedback form that we really want you to fill out. So if you want to participate in a community feedback, focus group, you can, there's a question there that asks you for contact information from where we can get a hold of you. Or if you prefer, you can reach out directly to Cassandra Bangay, and there's her email address.
Thank you so much, everyone, for sticking around. It was a really in-depth conversation, and we're just so thrilled by the comments and thoughts. And I think Kim captured it well. Settlement is so broad in terms of how we think about it. And if we want to be successful in considering a regional model that will work, I think we'll have to do some thinking about that, and that will be helped by some of our next steps. So really looking forward to your engagement and involvement. Our next opportunity to come together as this group is in May, as mentioned. We're going to put in the chat box how you can learn more about this project as we go. If you're not involved in the broader survey to services that are adjacent to settlement as a formal sector, or in a focus group, we will have a newsletter and we will have our webpage updated. So we will be sharing the recording of this session, and we're looking forward to keeping in touch. So I hope you all have a wonderful weekend ahead, and thank you again for all the time and thoughts shared today.